Good morning, everyone. We'll give folks just a minute or so we get everyone signed in and before we get going.
Morning.
Good morning. Cheryl Ramirez will not be here with us today, so I will be taking over as MC, as it were, for the committee meeting today.
Thank you.
I apologize if the screen share is kind of going in and out. I'm having some tech issues.
Yeah, it's working just fine right now. All right, you let me know when you want us to get going. Isabel, when everyone is got all the co-host permissions they need.
I think we are set.
Okay, fantastic. Well, welcome everyone again. This is the Finance and Revenue Committee supplementary meeting on August 19th of the Universal Health Plan Governance Board. I am Mimi McDonald. I'm the Executive Director stepping in just for this meeting for Cheryl Ramirez, who is not available today. So really excited to have everyone here. I think it's going to be a very interesting meeting, lots to talk about. So we will start off just with a roll call if you're ready, Isabel.
Yes, so Cheryl is here today. Chunwei, and did not see him in the list. Mary Lou.
I'm here.
Thank you. Richard Gibson.
Here.
Thank you. Jeff Goodman.
Present.
Thank you. John Santa.
Here.
Thank you. Bethany Stairs. I did not see Bethany. Charlie Swanson.
Here.
Thank you. That's everyone.
All right, terrific. Next, we'll move forward and take a look at the agenda for today. It's not particularly long, as we have 2 hours today. So we will go over just some points from the last meeting, some points of follow up, and then we'll have our consultant groups from Echo Northwest are going to go over revenue option and revisions. Obviously, this has been a topic that they've discussed a lot. They'll also talk about efficiency and equity issues in the revenue package, and then really coming together with what the next step should be from a committee standpoint. So very excited, as I mentioned, to go on with this. So I will say in 2 days' time, there is also a Universal Health Plan Governance Board meeting, which starts at 9 o'clock. So that'll be on Thursday. And the revenue options will again be a big topic. So anyone who's present here, if you have the opportunity, we would love to have you join at the board meeting. All right, so moving on, I'll just go over some meeting follow-ups. So a couple of points. We did have a meeting with our new consultant group, Milliman, and thanks to a suggestion from members of this committee, I actually did record the meeting, and the recording can be reviewed if you look on the meeting materials from August 5th. So if people who are interested, it was basically a little bit of a meet and greet and an overview of the plans. But thank you for that suggestion. And one of the things, of course, that came out of it happily is that our consultant group Milliman and Echo Northwest have been meeting together with the Universal Health Plan Governance Board staff, and then the chairs to really dovetail the work plans to make sure that they're all in alignment. A couple of other follow-up things. There was a question: was the industrial accident fund is that for injured workers, workmen's compensation? And yes, that trust fund is established for the benefit of injured workers and their families. As you all know, SAFE is Oregon's not-for-profit workers' compensation company. And then I just put a link to a couple of documents that have been created. There is a preliminary proposal about the forming of a public corporation that came out of our operations committee. And there was also a presentation by SAFE at an operations committee meeting in January. So I put the link there if people are interested in that. And then lastly, and Chair Ramirez isn't going to be able to comment on this, but we're talking about the federal budget bill. And Chair Ramirez has said she'll reach out to the co-chairs of the Ways and Means Committee for discussion of the Oregon response. And again, if you have there's a couple ways to look at that. There is Oregon Health Authority and there is a web page that's dedicated to the Oregon response, especially regarding healthcare. And then in addition, we'll also have an update at the governance board meeting this Thursday. All right. And today, just before I turn it over to our colleagues at Echo Northwest. Oh, Jeff, you have a question. I'm sorry, I just saw your hand.
Yes, just a comment. Thank you for the update. Appreciated. Subsequent to our last meeting, I watched the plan, design, and expenditure meeting. Oh, I missed the first 10 minutes of it. Just a couple of items to note, since we had talked about improved communication among the 4 subcommittees. The Plan, Design, and Expenditure Committee did not appear to know that we're talking $20 billion in change on an annual basis of incremental taxes, nor did they seem to know that we are talking as a plan design for our basis of calculations of a PEB plus. So I bring this up as just an example. I think there needs to be some improved communication. Admittedly, I missed the first 10 minutes, so it may have come up then. But during the remaining hour and 50 minutes of that meeting, there was no mention of the PEB plus that we're looking at and no mention of the 20 billion and change.
Thank you. All right. See, anything else? Oh, so one thing that I did want to comment upon, if people have not had the opportunity in today's meeting materials, you'll find a link to some public comments, and I'm so appreciative of public reaching out and providing with that. And the public commenters shared very much concern. These were people who were concerned about the impact of a universal health plan on people who are 65 and up. So please do read that. And in light of that, one of the things before we launch into the discussion of revenue, because of course we're talking about ways of finding more funding, excuse me, but what I wanted to do was really set the stage so people have, I feel that the committee members have a deep understanding of why we're doing this work, but sometimes it may not always be evident to everyone who's listening, or maybe listening to only a part. So let's see, Isabel, will you let me share my screen? Oh, and Charlie, you have your hand up. Please comment while I'm sharing my screen.
Yeah, so I have some, I guess, comments and estimates related to the budget bill, and a notion that related to a suggestion by Hayden Rookley that relates to both the short-term and longer-term options for decreasing the loss of federal money. So I'm not quite sure where that's going to fit in. It's essentially related to notions of how much are we going to need to raise in new taxes. So
yeah. Well, you know, at the end of the meeting, we generally have a little bit, usually there's some like time for member reflections if you feel like we can fit it in at that time, or we can add it on as another agenda item at a follow-up meeting or email it out. So I think we have a couple ways to look at
It
that.
might relate to what we're going to be talking about in revenue today, but I'm not sure. So that I just wanted to get that out there.
Okay.
So, yeah.
Well, thank you. No, absolutely. And if you, obviously, if you feel like there's a point where you're like, yes, that would be helpful, please raise your hand. So this, again, this is just briefly wanted to share a few minutes of talking about why everyone here is doing the work that they are doing. And this is taken from the KFF, Kaiser Family Foundation, this data. So it's taken from a healthcare debt survey in March of 2022. And again, this probably will not come as a surprise to many people, but 4 in 10 adults in the United States currently have debt due to medical or dental bills. And this slide just talks about some that they are either past due, that they owe to a bank, they've been sent to collections, they've had to do a credit card, you know, put on a credit card, and of course paying interest on that debt that they owe to a family member. So again, recognizing that there's a significant financial input on our current medical system, and then in specific, because again, those are the people from the public who provided a comment. They certainly said, well, I have Medicare and I'm fine, and I don't know how I could afford anything more. And what I will say is, if you look at this is again still from KFF, and I think this is fascinating, that one of the things that I think is really important to note is that for those 65 and older in the United States, far fewer of them do have medical debt, which is actually a very encouraging thing. So in other words, there are parts of this system that are functioning well for a lot of people. And I think that we really need to keep that in mind. Now, it's not great that almost half of people aged 18 to 50 have debt, and a little bit less than that, 50 to 64. But again, thinking about this in terms of the big picture, and as there are changes that are made or suggestions that are made, keeping that in mind. Now, another thing to mention, however, is that for those 20% of the 65 and up, so those folks who are 65 and up, and of course Medicare covers other than just 65 and up, but we'll just say these 3 in 5 of those older adults with healthcare debt have either delayed, skipped, or need to find alternatives to healthcare. So again, I think just getting back to the idea that the system is working, and it's working well for some people, but it's not working well for all people, and it is really not working well for a subset of some people. So, you know, if you think about of those 20% of seniors, almost half of them have put off or postponed getting the health care that they need. John.
Yeah, I think I've mentioned this before. I mean, I really think it's important that as we move along, we do look at people over 65 separately. Because Medicare has always been essentially focused on individual insurance, not group. The administration of it is unique and efficient. And this group is the wealthiest age group in the country. That's a good thing. You would hope that by the end of your income years, you have wealth to get you through the rest of your life. Some of these, I think, analyses don't define, are these costs costs that are covered by health insurance and for one reason or another weren't paid? Either the person doesn't have health insurance, or their health insurance is not covering this, or are they for expenses that aren't covered by health insurance? You know, I mean, I have many over 65-year-old friends now who have very significant costs not covered by health insurance because they have caretakers coming in. They have significant expenses that would only be covered by long-term care insurance. And even that, the long-term care insurers limit the degree to which they'll pay for caretakers coming into the home. I think we need to keep that in mind. And from a revenue point of view, again, I think the employer taxes aren't really relevant for the most part to people over 65. They're not employed, most of them. Some are, but most of them are not. The income tax is where all the action is. Would be interesting to know, for example, some of the information that we're now seeing, which I think is terrific. If you looked at people over 65 by income group, which portion of what income groups of people over 65 are sharing the burden. We got a lot of feedback from in the task force that wealthier people over 65 are going to need to be convinced this is for them, because that is where a significant portion of the tax burden will fall. I personally think that that's reasonable and can be justified, but it would be good to start to lay that out, because they will be there, and they need to be engaged. And oftentimes I don't find in most engagement efforts that they're a population that's included or come to that. So thanks for bringing that issue up.
Yeah, absolutely. Thank you for those comments. And I just have one last slide. This is not just the senior population. So this is all adults in the United States. Just again, when we think about who is covering the costs of healthcare that are not covered by health plans. All right, so this is out-of-pocket spending. So this doesn't include payment of premiums. This doesn't include anything like that. This is literally people getting out their, credit card or their checkbook or whatever it is. Now, this slide, which I think is useful, and again, when we think about people who spend a lot, who have a lot of healthcare bills, not surprisingly, that top 1% of people of healthcare bills, they end up spending, they provide 24% of the out-of-pocket health spending. So their average is almost $25,000. So again, 1% of the people are paying $25,000 out of pocket. Those are the top with the highest health spend. I think the other thing that is very interesting is then if you get even in the top 10%, these people are still paying at least, around $6,000, again, out of pocket, not talking about premiums, nothing else. This is just things that you need to pay extra for. The flip side of that, again, because I think this is important, is that half of the people don't have that, and they're not paying a substantial amount of money. These are folks who happily, they're doing great. They're healthy if they do see a provider because it's an annual visit, perhaps that there are no copays, no coinsurance because of the Affordable Care Act, et cetera. So again, just trying to set the stage. I know that the folks who are in this committee and folks who are involved in this are deeply aware of this, but to remind folks and the people who are interested in the work that these are the reasons that this work is being done. So I am going to stop my share. Thank you for allowing me that moment. And I am going to turn it over to Morgan Shook from Echo Northwest, who is going to now take you on the rest of the time talking about revenue.
All right, well, I'm mostly going to try to go through some slides really quickly and then get out of the way. for you guys' conversation. But first, I want to say thanks to obviously Charlie and Richard who dug in over the last couple weeks and helped put together some materials. Obviously Charlie and kind of working on the model, but also for Richard and taking a crack in that user guide. So Richard really put together a lot of that content and explanation. So hopefully that was very helpful. So I am going to share this slide deck. Oh, actually, before I gotta share it first before I turn it on. Okay. So I think it's useful to kind of step back here and just make sure we kind of do a quick level set. So at the end of last meeting, it was a great sort of conversation, and I think people started to sort of, I guess, understand how the funding tool was working and how it was trying to express what I think Charlie's words, the nature of the tax itself, but I think mostly a philosophical sort of to operationalize the philosophical principles that this committee has talked about, particularly around, I would say, two, I guess, economic ideas, right? Efficiency, sorry, three ideas, I would say. Adequacy, equity, and efficiency. So adequacy, right, is the first one, is are we raising enough money? And as we know, that is a bit of a moving target. We'll get some better clarity on this as Milliman's work continues to move forward. Just a quick note, right, on that question of adequacy. And I think last time everybody was looking at that kind of 22-ish billion. Remember, that was a fiscal year 26 estimate, but in the model, we're working in 2022 dollars. And so at that point in time, we're trying to solve for about 18.4. So it's just really time value of money and inflation. So just a quick piece of clarity. So we wanted to spend some time, right, talking about these sort of how do we sort of raise revenue and what tools should we use and what's the sort of relationship of them to the broader principles that you are trying to do. And I think those two broader principles are efficiency and equity. And so the efficiency piece here is really that, think of it as basically we're not trying to create too many distortions in the structure, right, that are going to impact the location decisions of households or businesses, right, so the economy can continue to work as efficiently and productively as possible. And then I see your hand up, Richard, here. And then the second question, right, is equity, where folks here have really wanted to pay attention to the progressivity of the tax structure, of the funding proposal, knowing that there are just proportionate impacts on sort of the ability to pay, particularly at the lower income side of things. So I'll pause there real quick and just as to kind of frame up our conversation today is to really tackle those three questions around how do we raise enough revenue, how do we do it as efficiently as possible, and how do we make sure we sort of put forward the principles of equity in that conversation. Go ahead, Richard.
Yeah, on this slide and the other slides, we're double using PIT there. We've used it.
Oh, yeah, I realized when I put that together, I was like, I sent it out and I was like, whoops. But
yeah, so I would call it a personal premium tax or fee, but I wouldn't use income there because I mean, it is go up with income, but I think it's confusing to have a premium income tax. Sounds like it's a special income tax, where it's really, I think Charlie's point was to make it a premium and not an income tax. Anyway, that's my point of view. Thanks.
Yeah, and I think that there is an open question about how does one operationalize this idea of a premium and cost sharing. One could implement it through the income tax structure, right? Or it could be separate. So I think, Richard, your point is like really important here, is that for the time being, right, we're not solving kind of like how do you collect the money, but the idea here is that there are sort of like something very similar to what people do today, an out-of-pocket sort of premium expense. Go ahead, Charlie.
I would expect that we would collect the premium as part of the taxes that is part of the income taxes. I mean, that's the timing that would make it efficient, but I think we need to use a different terminology for it, as Richard pointed out. But I do think that for efficiency purposes, it should be collected essentially at tax time.
Thanks.
I agree.
Right. So what I put together here for the slide deck is not a proposal, right? It's basically to help articulate the idea. So what did we do in the time between? So we made the biggest change I would say somewhat cosmetic, right? I try to put some more dashboard features so you could toggle things on that sheet and kind of see the adequacy change, see some of the efficiency equity elements. I mean, they're not full blown, but like I think they give everybody a really good idea about as you change the policies and parameters, you can see some of the effects that you care about. And then the other big piece here is we revised the sales tax, and the big piece of that is that the sales tax base is much larger, and so just a word of sort of just a caveat here, right? There's no sales tax policy in Oregon, right? And governments have choices about what falls under sort of taxable retail sales. Like with tax, like in the state of Washington, food and other kinds of sort of necessities are exempt from the sales that aren't included in that. We are kind of pulling some of that stuff out. So we're trying to basically make it a sort of like, yeah, this stuff feels like it's about would fall under a retail sales tax. The implication of that change here is the rates that you were looking at last time from an order of magnitude are raising more revenue. And so I think people's questions of like, oh, I was disappointed the sales tax is not raising enough revenue with this revised sort of estimate of the retail sales, you could actually add a sort of comparable rates to bordering states. You could see significant revenue being raised out of those tools. The other piece here is we added 3 of the sin taxes. So we've got cigarettes, beer and wine, and marijuana included. So you should have those things to play with. So let me give you just a few. Let me just kind of roll through these pieces, and I think Mimi, the way I would maybe want to think of, and folks here want to jump in, but maybe we talk a little bit about sort of the adequacy piece, and particularly the inclusion of sales taxes and sin taxes as a first piece of the conversation, just to see where we have consensus around sort of the, call it the core proposal. We can have alternative proposals as well. And then I think we can get into the much sort of meatier side of that set of conversations around the sort of how do we implement sort of the efficiency and equity elements of the conversation. So with that, let me just kind of roll through what I say, well, I'll call it just like a core tax proposal, the rationale to do this, right? So I needed something to anchor this on. And so basically this scenario was really trying to sort of balance out what you see the corporate contribution. So from the current situation to this alternative, and that's through some combination of adjusting the corporate income tax, the corporate activity tax, the payroll expense tax, while sort of then embedding sort of these equity provisions that you talked about. So the biggest one of those is 100% sort of credit of the payroll taxes on an individual's personal income tax. Okay, so that is sort of forms this core call it scenario. I am not including any of the additional taxes, so sales, lodging, cigarette, beer, wine, marijuana right now are just off, just so you can kind of see how that performs. So big thing right here is I think a point that Charlie and others have made, right, with the credit of the employers spending on the employee. This is a Seattle thing. The employee, it should be EPT. Employer payroll tax is credited against the individual's income tax, and then there is a sort of soft cap, right, embedded in here that caps the contributions, or relatively marginally caps the contributions of high income earners. So this question that we have had around excessive sort of potential tax burden. And so what does that look like? So when we think about trying to raise roughly $18.4 billion in 2022, what we see here is the majority of that tax, right, is falling. Wait, did I put the wrong? Sorry. Oh, interesting. This should be the payroll tax, not the personal. I wonder if this is a piece, but basically will fall on a personal income tax. And I might have pasted in the wrong chart here, but let me double check that. And the big piece here is really, I think, this question around anchoring. So we try to keep the contributions the same. So basically positive means they're paying more, negative means less. So basically the employer payroll tax is replacing their existing employer premiums, and the majority of the funding, right, is falling on individuals through some progressivity of the income tax or through per individual premiums. Okay. When we think about sort of the rough distribution of this, right, is that given the way we have it phasing in this process, so we go back to the phase in, I should here, a personal income tax rate of 6%, the exemption level, so basically incomes under 140% of the federal poverty limit are exempt. The soft cap starts kicking in at after individuals have made $50,000 of payments, and that rate drops from 6% to 5%. And the personal premium begins at 200% of federal poverty level, and that's roughly about $5,000 per individual. So when we look at the rough effects of those pieces, particularly on the personal income tax and the personal premium, we see sort of the adjusted net total taxes paid. So you see starting right about at adjusted gross incomes about 45 to 50,000, all the way up to $500,000 plus, how that those progressivity or equity sort of parameters play out in this sort of proposal. Great. So what happens then when we add the additional taxes? And so I just tried to keep things roughly the same, mostly just so we can keep the corporate contributions the same, but then some small changes to the soft cap. And then on the additional taxes, I said, okay, let's just pick 5%. There's no rhyme or reason to that. The state rate in most Washington is around anywhere from 8.5 to 10, depending on where you are, or not but the total rate, the state rate is 6.5%. Lodging taxes, I said, let's double it, right, from its current 1.5. Cigarette tax, let's double it. Beer and wine tax, let's double it. Remember, in the beer and wine tax is actually a tax paid by businesses. I'm sure they're probably at some point fully paid for by buyers. And then we've also doubled the marijuana tax. And with all these things, right, we're ignoring kind of the dynamic effects of making things a little more expensive relative to the revenue it raised, right? So the elasticity here, we're assuming, is 1. So for every point here that we raise the tax, we're basically getting the same amount of revenue going forward, but that's probably not likely the case in reality. Okay, so what happens here? So what we see here is that you can raise significant revenue from a sales tax, somewhere in the range of what is raised in the personal premium. So that $5,000 premium kicks in at 200% of the federal poverty level at $5,000 per individual, right? 5% sales tax kind of mimics the same amount of revenue being raised. Your sin taxes are, you're doubling them significantly, but even if you're doubling them, you're still not raising sort of like significant, but in the sort of, tens to hundreds of millions of dollars of revenue. So the sort of choice to sort of what the right rate is I would say more probably about public health policy as opposed to sort of a revenue strategy. So that's not probably something to consider. So then what happens here? The private employers pay a little more. This is mostly a reflection the fact that of the beer and wine tax right now from a first incident perspective is being categorized on employers. But you still see significant revenue here falling to individuals. So revenue that was raised mostly through personal income tax or premium, right, is now basically being borne through the sales tax. And so here's where the revenue is actually on individuals a little more, but because you're looking at a sort of sales tax and the fact that the sales tax is flat for every individual, right, there are sort of slightly marginally more regressivity concerns with that. But from a revenue strategy, you basically kind of swap those two out. You're trying to solve for the 18.4. On just the premiums and personal income tax side. So here we don't have data to be able to fully integrate the sales tax, but I would expect if we were modifying this, you would see higher contributions at the lower AMIs, excuse me, at the lower adjusted gross income levels. Okay, so I'll pause here. So I think be good to hear from everyone. Just one, if we have questions, but two, I would love to hear folks start to sort of frame up what they think, how we should be thinking about sort of the core sort of meal components versus some of the side dish components, and particularly around the sales tax. Richard.
Would you please go back to slide 12? So,
Here we go.
yeah, so on this one, this slide represents the difference from current.
Correct.
And so if we look at the employer, you're comparing what they would pay in terms of employer payroll tax versus what they paid under premiums.
No, so in this version, yes. Oh wait, right here in the sort of without the sales tax and the sin taxes, that's what that is. So that's and
All
so
right, let's do this one then. Okay. My
Yeah.
point is for private employers, are we comparing payroll, employer payroll tax versus what they paid with premiums?
correct.
Okay.
Yeah. So this is just illustrative to try to sort of say the principle of like, let's just try to swap out the payments.
And then, and then under individuals, is that net of the credit they get from what their employees had paid?
Yes. So two follow-ups, Richard. So the private employers also so think of it as basically we're balancing out the corporate income tax, corporate activity tax, and the premiums total. So basically we're saying, what are you paying in premiums today? And then we're balancing out across these contributions across those three sources.
Yeah.
Okay. Yeah.
But-
And yes. And then the individuals is net of the credit.
Yeah, okay. A couple things is number one, I really love these slides that show the effect of it. I really think that we need to have the current and the future because you look at this, your initial look at this saying, man, individuals are getting killed on this. And that's partly true, but partly not true.
Yep.
The other thing that we need to have on that slide 8 is, and I've talked about this before, is we need to put what they're paying out of pocket right now, because that's a big chunk of that 4 billion that they're paying. I mean, I was going through the numbers right before the meeting. We're already at about 4 to 5 billion of what they're paying out of pocket now under the current system. So it looks like individuals are getting hit really hard, and perhaps they are, but it's dramatically mitigated by the out of pocket, the premiums they pay, the out of pocket, the deductibles, the copay, all that. That mitigates a lot of that income tax, and we need to start getting that on there so it looks better than it is. Because right now it looks like individuals are getting killed on this. Over.
Yeah, no, I think your point is well taken. I think, and partly is this kind of a modeling tool, and I think just remember, kind of our work here was really to say, can we get a proposal in shape that then we could go do the deeper analysis. And so I think part of this is like the work that Charlie's done here is really great, right? To be able to kind of say like, let's move some things around and have it reflect kind of what we think, what the current situation is relative to an alternative situation. So you can answer these big equity pieces to be in the right quadrant. And then we can do some refined analysis to dig a little deeper. And then you can kind of come back and say, well, let's tweak this because we're learning, we're hitting people, at the lower income a little harder pre-post in this kind of scenario kind of thing. Charlie.
I think we can add in what Richard is asking for overall,
Yep.
for individuals overall, but I think it's going to be
That's in
really
there.
hard to do it by income level.
Yeah.
But yes, we can probably do that overall piece. We can make an attempt at the income level, but I think that's going to be pretty tough to do.
We have some stuff from the state of Washington that we might be able to exploit. All right. So let's go back to the question, I guess, around the composition. I feel like the last meeting, folks felt, hey, personal income tax, the three kind of business or employer sources, plus the premium are really kind of what we're dealing with. And then the question is there consensus to include a sales tax as kind of maybe we'll call it option one versus, or do we want to keep it on the table? I think is the probably the question that needs to get answered today.
Charlie.
Charlie.
My general feeling is that I don't want to include a sales tax, but I think it would be useful to um, put forward a proposal that doesn't have it and it's another proposal that does have it. Um, again, generally, I would say I don't want to include it, but I think it's useful to have it there for the governance board to look at once we get far enough along that we can make some estimates.
Mary.
I think I pretty much agree with Charlie. I am pretty much anti-sales tax. Just in the general out there, everybody moaning and groaning and talking about taxes in Oregon and how terrible it is, and how everybody quote unquote's moving to Vancouver to get out of Portland to stop having to pay income tax, and they're going over and paying sales tax. But And I argue a lot with people and say, look, yeah, upper income people who don't buy a lot of stuff, they probably do get along better if they're employed, et cetera, and working over there. But if you live over there and work here, you still pay. So anyway, I don't know. It's just kind of the general tone out there about this terrible income tax that we have in Oregon. And then when we, float, well, we're going to make it, much bigger because you're going to get free healthcare kind of thing. I can make that argument, and I do, but, and the lower income people, sales tax is just, no matter how much you exempt, the more you exempt, the less you bring in. But if you don't exempt a lot, then it really is a very regressive tax. And I don't like regressive taxes.
John. Oh, you're still on mute, John.
I agree with the two previous comments. I mean, I think I really like this analysis. And, when you popped on the analysis with the sales tax, you started to see some blue bars show up in low income. And, you acknowledged that the analysis was probably incomplete. But I think you could start to see contributions. And of course, what this doesn't do is, as a portion of their total income, when you're at 15 to 20, $100 is a large portion, much larger portion than when you're at 200,000 income. And so I think even the analysis you've done suggests that there is significant regressivity that start to show up. But I think it's good for the board to see that, and if they want to go with a sales tax, at least they were informed. I'm still a little bit unclear. Are we going to talk about the sin taxes separately?
Yeah, we'll cover that next. I just like keep one at. Let's do sales here, and then let's come back to the sins.
Yeah. Okay.
All right, Jeff.
Thank you. I agree with the comments about a sales tax, even a well-structured sales tax, where it hits people and it's regressive and all the things that have been said. But I'm not sure at this point that a sales tax should be taken off the table just simply from an analytical view. There's a lot of dollars there, and we're looking at a lot of dollars. So this may be a question that we need to, I think it's been suggested by, I don't know whether it was John or Charlie or so, that this is a question to take to the governance board and say, do you want us to go down this road with a sales tax? Because simply because the dollars are so significant, even though I don't like it. Thank you.
Yeah, thanks, Jeff. Mary Lou. Oh, you're on mute.
The other thing is, have we looked at setting up and running a sales tax? I don't have any concept of what kind of the net is. Okay, so you bring in this much, but do you have this huge administrative cost behind it? So how does that play in?
Yeah, just in Washington, the way that it works is of the rate you think of it as, there is a certain part of that rate is dedicated to, in terms of the, think about it like, okay, if we're charging 5%, it raises 4.2 billion. you take a portion of that rate to accommodate for the administration of
Mhm.
by the Department of Revenue. And then there is a small, because the businesses are the ones actually collecting it and then remitting it to Department of Revenue, there is also some small sort of credit for them as part of that sort of administrative process.
Any idea how, is it 5% of the take or?
No, I mean, like in Washington of the state rate, you're talking like, I think, hundredths of a percentage point. I want to say is it, but I can double check it. I
Yeah.
have it somewhere there,
Okay.
Charlie.
I no longer have a question. I guess I was just going to, well, I would suggest look into that. And also, is there initial setup cost? So I think both of those things are questions.
Sure.
Mhm.
Mimi, do we need to do any kind of voting or polling as we kind of talk about sort of options, kind of like we call it a preferred option versus an alternative option?
So since
I
this
don't know
isn't,
what
yeah,
the order is here.
no, I think not, because this isn't even, or we are not at the point yet where it is even a proposal.
Yep.
So I think right now, because as we talked about, you're going to present to the board, and you can just simply say from the members, and not wanting to call out anyone, but if there are members who haven't spoken up, if they would like to, we'd love to hear from committee members that have not had a chance to weigh in on this one. Thanks.
I'll ask Bethany since I haven't heard from her. Bethany, any heartburn about sort of the preferred kind of right now being kind of no sales tax, but keeping one on for study purposes?
I don't have, I mean, I'm with agreement with everybody else pretty much.
Great. One question we'll have to come back to on the sales tax is the revenue raised. Like, what are we trying? What part of the additional sources are we basically adjusting for? So, what rates and individuals would be particularly paying less if we're trying to raise 4.2, whatever the number is on the sales tax? But we can come back to that. On the sin taxes, great. So the sin taxes themselves don't raise. Where is it? A lot of revenue. We're typically in the, I think the most in the $500 million range with the cigarette tax, and then significantly a little more. Not a lot of revenue in the beer and wine tax. And the rates like I said, I put in here are doubling the existing rates. So very, very significant.
Wow.
Yes. So, and that's not a real proposal. That's really kind of just so you understand the nature of the magnitude, right? If we just went crazy with it, like how much money? Not a ton, and it ignores all these elasticity issues with the increased rates. So, I would like perspectives on with your sort of core proposal, the inclusion of we'll call it, sorry, not just all sin tax, but the lodging tax, right? For a nexus. We don't know quite sure what that rate should be, or like any of these pieces, but we can talk about that. And then the inclusion of sin taxes and your perspective on that. So two-part question, lodging taxes and sin taxes.
This is Mary Lou. Do you want me to say?
Yeah, go for it. We are ready.
Okay. Having worked in public health for many years, but have been not working in it lately because I've been retired. But that cigarette tax, we had, at least the last I knew, one of the highest in the nation, finally. New York, I think California, us, but it was, I have lots of scars on my back from that, just trying to get it, up to in the dollar range, and the fact that it's gotten up to 333, and I'm all for it for the the reasons that public health cites and the studies that show that people do use less, especially younger people. They don't start out as, because it's quite expensive, etc. So, but it just whoa, that's going to be a huge group of expensive lobbyists that will be quacking about that a lot. And I'm all for, since we have such a low beer and wine tax, I'm all for really going up on that one. Although, again, we will have the lobbyists that, have been very successful over the last 30 years to not get it raised. I'm fine with the doubling the lodging tax. I mean, indeed, there are times when we go in Oregon and stay someplace, so we're residents, we would pay a higher room rate kind of thing. But I think the majority of lodging taxes are paid by out-of-state people. And one of the big things that people like to argue and whine about in Oregon is that since we don't have a sales tax, that we don't get anything from those people that, come up here and have all the benefit of Oregon, but don't have to pay. So I kind of like making it as much as you can. And then, you know, I I don't know about marijuana, whether, how that would be or not. So anyway, those are just my first thoughts on them.
Others here.
I think we can link sin taxes to healthcare pretty easily for the reasons already mentioned. So I think it's reasonable to include them. On the lodging tax, not sure that has a connection to healthcare, but I think we could earmark the lodging tax to the administration aspects of administering claims for people that come in from out of state. We haven't decided on how that would be, but if we take the idea that we really want to keep providers from having to bill the state, the universal health plan, and billing some provider in New Jersey, that would just ruin the administrative efficiency. So the possibility is the state could bill for them. We've talked about this at previous meetings, or at least the board has. So I think it makes sense that some of the lodging tax could be earmarked. It's still part of the universal health plan, but it could be earmarked for covering some of the administrative expenses of taking care of people from out of state. Granted that some of the people that are staying in hotels are from in-state, but in general, I think that's an approach that would make sense to the regular person.
So, Richard, would that be not necessarily increase the rate of the lodging tax, just take a portion out of the existing
Oh,
proceeds?
no, I'm sorry. Let's go with increasing the lodging tax, but the reason we could justify it is because there's administrative burden for handling for out-of-state people. Thank you.
Okay. Others, please.
Yeah, I'd second Richard's comment. I think the lodging tax should be there, but be there as a way of funding the administration of out-of-state folks. And to the, again, degree possible, getting the delivery system out of that administrative business. I still remember the comments about the fellow from British Columbia and how the Canadians do that. And I think it's a real opportunity to reduce administrative costs across the delivery system. That's one negotiating point that we want to have in our pocket, and this tax would be devoted significantly to paying for the administration of that, and not having that on the delivery system, nor the risk of it. So that's number one. Like Richard and others, I'm very comfortable with the sin taxes because there is a direct relationship. And in fact, you can argue to the taxpayers that this portion of the taxes would go directly to healthcare costs related to these. I would like to see high sugar foods on that list as a new sin tax. And the other thing I was a little concerned about, Morgan, was that I think in the analysis, if I understood it correctly as I read it, those were somehow being considered employer taxes.
Just the beer and wine, because the cigarette, marijuana, sales tax, lodging tax, those are all paid by consumers, but the beer and wine tax is actually a use tax paid by the business. Now, that's like a first instance, like who's writing the check. But typically these kinds of things and consumer products are embedded and consumers are paying it. But because that's how we're treating everything else, that's how we're treating it right now.
Yeah, because I think it needs to be changed to the way we do the others.
Yeah,
and so the individual clearly sees I'm having to pay more tax because I smoke or I drink.
No, the cigarette, beer, and marijuana, and the cigarette and the marijuana tax are included in the individual side. It's just the beer and wine tax, which is technically a business tax.
Yeah, because as I mentioned last meeting, I'm following very closely what the impact overall is on employers, for at least me, an objective being that we can argue that you're not paying more, and hopefully you're paying a little bit less. Anticipating that, again, for employers, this is going to be a decision they're going to have to make individually. We're not going to be able to impose this on self-insured employers. And so it's going to need to make a business sense to them. At least that's my sense.
Okay. Thank you, John. Others, please.
I guess I'll go. I basically agree with what almost everybody else has said. And I do agree with John on the beer and wine tax being essentially put on the individuals in the accounting. And the reason for that is the other taxes are on all businesses. The beer and wine tax is a very special tax on one single sort of business. And so it's not like it's generally attributed to businesses, which the other ones are. And so I agree with that being put back in the individuals. And as far as the rates, I think the rates for most of the sin taxes, I think, should be based upon public health arguments, not revenue arguments, as you've mentioned. And for the lodging tax, the other reason for it, it's not just the administrative. I think it should be earmarked for administrative simplification for out-of-state residents. But there's also potential payments for out-of-state residents getting emergency care that is not reimbursed, because if they are not insured and they need emergency care while they're visiting, then that's a cost to providers that should be reimbursed by the state. So another little piece there, another reason for having a lodging tax. I'll stop there.
Thank you, Charlie. Jeff.
Thank you. I agree with Charlie that the argument about cigarette tax and beer and wine tax has to be, and quite frankly, the marijuana tax has to be on the basis of public health, because we do not present a good logical argument by saying, on the one hand, we're concerned about lower income people not wanting to have to pay additional income taxes, and on the other hand, all the data that I see and have read is that it's primarily lower income people who are paying the bulk of the cigarette, beer and wine, and marijuana taxes. So if we want to at least be logically consistent, we have to drop the revenue argument on these and focus on the public health. On the lodging tax, I am indifferent. Thank you.
Thanks, Jeff. Bethany? Okay. Anybody else with thoughts? What I am hearing, the consensus is that there is a nexus on the sort of lodging tax for emergency care, as well as sort of administer claims. The sin taxes, I would say everyone feels on the public health, either indifferent and or feels like there is a strong nexus piece, noting Jeff's point about the regressivity aspect of that. The terms of the exact rates, I would say maybe what we can do is take a look at some of the existing literature here to understand sort of the nature of the expense to the rates and see if there's any guidance there, because, you know, frankly, what I have in there, unless anyone has strong feelings or knowledge around what the rate setting aspect of things, but I'll let Mimi go there, and then Mary Lou.
Yeah, just for something to add, certainly the staff, we can look into some of the sort of cost analysis of the cost in general to the healthcare system for use of tobacco, for use of marijuana, et cetera. And then also there's a lot of data about how much of a reduction you will get by an increase of a price point for percentage. And I was just going to ask if this group would be interested in looking at, in addition to a cigarette tax, but actually a vaping tax, which is actually Oregon does have one, but not at the individual level. So they're interested in that. And then also if there's interest at looking at a sugar sweetened beverage tax, which I admit, along with Mary Lou, is something that I've worked on in the past. So just more of a question.
Mary Lou. Nope, you're on mute.
I personally like sugar sweetened beverage tax because I worked a long time on it about 10 years ago and we didn't get much traction on it. It is complicated. I'll tell you that. I know enough to know it is not a simple thing. And where do you tax it and all that? So I'm not going to go there. I guess just one of my questions is one of the things that often comes up with any of these kinds of things, and maybe it's not relevant here because we're not just focusing on the cigarette tax, but I have lost track and I have no idea what Washington State's rate is, because people talk, well, they'll go to Washington, just like we yell, all those people from Washington come shop in Portland, and it's kind of moot. But anyway, it often kind of gets everybody off track into arguing about things. So that's just a question of mine. But the public health thing, clearly, and I know that just the latest stuff that's gotten it up this high, they've done a good job of validating why the rate is the rate it is. And I don't know whether they've got more data that shows if it was, really higher, what, starts getting incrementally smaller public health outcome as you get, you've already kind of gotten it, I think, in some ways by, the 333, but I could be wrong. Like I said, I haven't done it in a long time.
Great. Any other thoughts on sales taxes or lodging tax or the sin taxes? The way the quick recap I have here is there's consensus to, as part of our sort of core proposal, to include a lodging tax, as well as the current list of sin taxes, but also explore some of these other ones as a potential ones to include. We've got some follow-up to look at the administration costs, the sales tax, but also look at the rates in Washington in terms of what sin taxes are there and the rates that are currently being used. So you can pull that information back as part of the conversation on that piece. And so then that's our kind of core, call it our core sort of scenario for the time being. We won't use proposal quite yet. And then we also have an alternative scenario that will include, I'm assuming, all of those same taxes, but then also include a sales tax. Great. Let's move on to the next set of meaty questions. And the first one, maybe it's a little easier here, is to talk about sort of the extent that small businesses are subject to the payroll employer. I keep calling it. Sorry about this. I've been involved in a Seattle process where it's called the payroll expense tax, but I'm here. It should be employer payroll tax. Sorry about that. And then, so the big question here is where to set the thresholds by kind of business size as measured by total size of the payroll. What I understand here, probably the big trade-off here is, maybe there is a kind of equity angle, but I think mostly it's really kind of the administrative burden on very small businesses relative to the revenue that they may generate. And so just so you have some rough understanding as you kind of play with the model. But if you reduce it from 300 to 150, right, it basically has an additional $100 million in revenue by doing so. I want to get some conversation and discussion on this topic, and then we can kind of run through the other ones, which are going to be a little meatier, I think. Richard, and then Charlie, and then
Yeah, I think this is one where we're going to get a lot of pushback in Oregon. I totally get it. Small employers that don't currently pay any health benefit and premiums, and now we're asking them to pay. Yeah, this is going to be tough. I'm not sure we can sell this, but I think that we should raise that threshold. The other thing, I don't want to complicate it further, but the other thing is we like to avoid cliffs. So what we could do, make some spreadsheet more complicated, but above 300,000 to gradually bring in the payroll, employer payroll tax. So that's another way to soften it, because we don't want people that just go up to 299,000 of payroll and then don't hire anybody else, that sort of thing. So I think this is going to be a tough one, but I think we should have it. And for the other part of all of this is the juice worth the squeeze. And we're going to have to, I'm imagining myself getting out in front of a community anywhere in Oregon, but not urban, for example, and have employers there and have small business people there and self-employed people there, and having to justify this kind of tax increase. And it's going to, for raising $100 million, it's not worth really digging down into small employers. It's just, it's not worth the pushback. And I don't think it'll sell as well. Over.
Charlie.
I mean, so one of the things we need to remember is that a couple things. So, yeah, it reduces revenue, but we're going to get that revenue from the personal income tax anyway. So most of this is not really, it's not revenue that comes into us. It's revenue that gets used to provide a credit to the personal income tax that's raised. And so it's not really a loss of revenue. And as far as the cliff part, that's already taken into account, because this is the amount of revenue, the amount of payroll that is exempt from the paying the taxes, paying the payroll tax, and there's a marginal rate above that. So there's no cliff involved, which is why I designed it this way, is to make it cliff free, essentially. So, you know, if you go from 300,000 to 301,000, you're paying that, or 299,000 to 301,000, you're paying it on only $2,000. You're paying that payroll tax on only that little tiny bit. So there's not a cliff involved, really. I do agree that we want to set it high enough so that a large portion of the small employers that do not currently pay for employee health care won't have to pay this new tax. And I don't know exactly what that number should be. That's where it would be very useful to talk with more people within small businesses and try to find out what makes sense for it. But I do think that it should be high enough that the majority of small employers, actually the majority of employers, in fact, don't pay the tax because the majority of employers are fewer than 3 employees. They certainly don't employ the majority of the people, but the majority of employers are very small.
Yeah,
we'll stop there.
Yeah, maybe Charlie, one kind of follow-up question, maybe get a comment from you. Just you raised this earlier, and I think people talked about it, like, how are businesses paying? And I think one, right, they're paying through marginal increases in either the corporate income tax or the corporate activity tax. The employer payroll tax rate was designed, at least thought principle, to basically be a substitute for the existing premiums paid by businesses. Changing the threshold here could do 2 things, I think, as Charlie articulated. One, it could actually raise revenue depending on the amount of credit, right, that is going to flow back to individuals. So basically think of it as, if you have 100% of credit, you're basically saying, by including more or less businesses by payroll size, you're basically saying, well, how much more am I going to distribute the potential credit to on the income tax side, right? But then the question then is always then back to sort of like, well, what are businesses paying on those other 2 taxes if you're trying to sort of net out sort of their current contributions versus new contributions. So maybe Charlie, I don't know if you want to kind of.
Well, so there's one other exemption that we need to think about as a question, and that, so it's not just on the total payroll, but it's the amount of each individual employee's payroll or wages that are not subject to the tax. And that I generally defaulted it to 100% of federal poverty level, but that could also be raised up to match the rate. I would think that it makes sense to set it the same as the the exemption on the personal income tax. I mean, that would be another possible choice to make. And I've also made the choice that it's only on the employer side, the employer payroll tax exemption for each individual employee is only based upon that employee, as if they were a single person for federal poverty level purposes. And to me, that just makes it simpler for employers to not have to worry about, well, how many children do you have and all that stuff. So it's just a simplification for employees. And again, because either the employee or the employer is going to be paying it, I don't think it really affects the general overall progressivity. But if we do raise the exemption, I think we should also raise the rate, that the marginal rate, so that we end up getting about the same amount. So that would be my general feeling, that as you raise the exemption, you raise the rate to end up with about the same amount from the employer payroll tax.
Yeah, thank you. I think I was kind of in my mind where I was trying to get to, sort of like, how do you get to the right equilibrium there? So thanks, Charlie. Mary Lou.
I was interested, number one, what did you say when you said somehow you said something about Seattle and whatever? I don't like the name of this thing. And so what is it they're calling it? Is it something?
It's a completely different tax, and
Oh,
this is like, I
okay.
get it's the same letters, but employees and payroll, but they're different. They're different things. So
All
it's
right.
just the employer payroll tax, which is
All right. Okay.
what it is.
Okay. I still will confuse everybody out there, I'm
Yeah,
convinced.
sorry
But
about
anyway,
that. That was my own confusion there.
yeah. The other piece, though, is I agree. I think it was with maybe Charlie or Richard. I can't remember, but how much is the squeeze worth the juice? And that, to raise that up on that dot point from 150 to 300,000, reduces the revenue by $1 million. Well, that's kind of decimal dust in this whole way that we're talking here for raising revenue. So I'm all for raising that threshold to what seems to be reasonable, so that we don't, and we don't lose that much revenue doing it. But the other things, I totally agree with both of John or Richard and Charlie.
And I think particularly what I think Charlie's saying here is like, the sequence of sort of agreement is replace the payments of businesses on their health expenditures, and then set the threshold right and match it with the right marginal rate to get there. Okay. John.
Yeah, I'm for raising this threshold. I do have some concerns, like, when I hear that the average number of employees is 3, it reinforces a bias I have, that there's a lot of individuals who are making significant amounts of money who become a business because of the tax advantages of that. And so they're a one-person business, whether they're a lawyer or a doctor or whoever. And so it concerns me that as we increase this threshold, are we encouraging that? I'm trying to follow Charlie, and I think that he's thinking about that. At the task force, we did certainly hear back from small employers who had multiple low-income folks. I almost wonder, is there some kind of criteria that could be added in terms of average salary, so that this was targeted to help the small employers who are employing low-income people, something along that lines. But I don't mean to complicate this discussion. I mean, I'm for the direction that you're headed.
I think Charlie has an answer there.
So the way that this is designed, with 100% credit of the payroll tax towards the personal income tax, the total amount raised by the state doesn't change whether you make them employees or you say, no, I'm not an employee, I'm just getting this money. And so it is it makes no incentive to say, yes, you should form a business, or no, you shouldn't form a business, because it's the same amount of money that's going to go to the state for
Okay.
healthcare taxes. And that was by design, so that there's no incentive to do one or the other. It's merely to say, okay, small businesses aren't paying now, so let's say they don't pay in our system either, but we still get the taxes from the individuals.
Okay.
Other folks on this, but I'm hearing that there's some agreement here that match the payment, set a higher threshold perhaps, and match that with the right marginal rate. Great, I see Richard nodding. Any other opinions or perspective there? If not, I will move us on to a really meaty one. So Charlie, maybe or Richard, either one of you want to talk, since you're, I think Charlie, probably the best architect of the crediting the employer payroll tax against the income tax, and structuring it here has implications not just on sort of equity, but how the revenue is raised. So and particularly around the sort of double taxation piece. Do you want to maybe start that conversation first, and then others folks please chime in here on sort of, you know, why you would do this, and two, why setting it at 100% versus some other number is meaningful.
I think I've said most of what I wanted to say on this before, and I'm not quite sure if I might need to hear what other people's thoughts are or questions are before I comment anymore. It's just like, I want to avoid double taxations. And so to me, 100% credit is necessary. So yeah, I'll
Great.
stop there.
That's exactly what I wanted you to chime in with. But others, please want to build off of that kind of key point in the design here. All right, John.
Yeah, I'm for this, and I understand it. All I would suggest, and this, you know, makes the statement a little more complicated, is we always make it clear this is a state tax credit, so that there's no confusion that this is applicable to your federal taxes. Get in the habit of, this is a state tax credit against state personal income tax.
Okay, Mary Lou.
I still don't know that I can say like John that I totally understand it, but that's okay. I do think that the six, you know, if it were lower than that, if it was less than 100%, which I don't know that people understand exactly, and that maybe we could do it and pick up a couple billion here and there. But I'm not going to sit and argue it, or, you know, I just think I need some real tax 101 again. But we do have, like Oregon has our own, we have the political credit that nobody, you know, it isn't off your federal, it's just off your state. So I think helping people understand that it's from the state part is not a problem. So
Yeah.
I'm going to stay neutral here.
Yeah, if it's helpful, the double taxation piece is really comes down to your perspective about employee compensation.
Yes.
Okay, great. And so if you
Right.
understand that piece of that, that would be the only controversial part here, is your perspective on that. Okay.
Right. And I do not agree that if they didn't have to pay, you know, they're going to put that money into the employees' hands. I just totally disagree that that would happen. But that's a personal belief. I don't know why I don't have any data to support it. Maybe Charlie has data to support his way. But anyway, so I'm not going to stand in the way of this.
Charlie?
So I will actually say, let's think about the other way around. Suppose that we said, okay, employers, you're going to have to pay more money for healthcare. Do you think that they would not try to lower the wages of the employees? I think they would try to lower the wages to make up for it. And that's what they do in all union negotiations. If you say, I want more in healthcare, well, then you should get less in wages. And so maybe you don't see it with the employers if
Yeah,
they
go
don't
the
have to
other
pay
way.
as much, they don't have to pay. But if you look at it, if they have to pay more, they're going to
In-
lower the wages.
Yeah. In
So
reverse,
I think they're very closely connected.
yeah, I guess that makes more sense to me, Charlie. But you know, I don't know. I
Okay.
think we could argue it either way. And like I said, I'm just going to kind of stay out of this one.
Okay. Others, Richard, Jeff, Bethany.
Yeah, this, Richard, I agree with the 100% credit. I think it's a conceptual issue. When I wrote the background to the tax calculator, I put it as a conceptual issue. I'm not saying it's right or wrong, but certainly Charlie makes a great case, and it makes sense to me that one way or another, whether someone would literally, an employer would literally give it back to the employee or not, yeah, that's not really the issue. We're just talking about the general way, and so I'm in favor of the 100% tax credit. Over.
And I guess as I think about it a little more, I'm in favor of it because it will be a good point for people. I think it would help in the sale of it too. So I know that's not our job. Our job is to really come up with what we believe is the best system, the best plan, the best everything, and that's the advocates and others to sell it. But I do think we have to give them something that has the potential to sell. And I think this would help.
Yeah.
People like 100% tax credit. I mean, that sounds really good.
Jeff or Bethany.
I agree. Nothing more to add.
Bethany.
I don't have anything to add either. Thank you.
So I'll settle this as sort of our understanding here is our core proposal will have this credit as part of sort of that scenario. Then let's talk about the next big piece. And so,
hey, Morgan, sorry, I should have put my hand up. One more thing is I really like to come back on those charts and show current what employers pay and then what they pay under the new one, not just the difference. I mean, I know it's a small point. It just looks like the employers are getting away with something there, and that's not our intent. That those charts just showed the difference. But I do think here's what you're currently paying, here's the other one, and I want to see those employer things that employers are there. It's a visual learning mechanism. So we'll add a graph if we're
yeah. Yeah, so maybe one thing I can do after this meeting, basically, I can revise the deck and say, hey, you guys agreed to something, a scenario looks something like this, and they can add those charts in there for clarity.
Thank you.
Yep. Great. So let's move to the piece that Charlie rightly integrated here in what we're calling kind of soft cap. So I would say the simple version here is in the scenario we've been looking at is let's mimic the current payments of employers for premiums, but then let's reconstitute it as a payroll tax as the sort of first incident. That's how it's paid. And then because we want to avoid double taxation, let's include that as a credit. And one can phase in that credit at different levels of adjusted gross income. But the net effect of this is to push the relative burdens of funding the program through a more progressive income tax. And that's what we see in like this, right? As incomes rise, we see larger and larger total payments for either the income tax or a premium at higher adjusted gross income, and while keeping the burden very low for folks at the lower income levels. And so the question that was raised here is, how should we handle this, and how should we handle caps? And so the way Charlie designed the sheet is to say, once you make a certain amount of payment, right, that at the margins, every dollar above that should be sort of taxed at a much, much lower rate. And so there are questions on, I would say 3, should we have these, right? As a question. And then if once you get, and the answer is yes, then is sort of how does one sort of think about sort of where that threshold is? 20,000 total contributions, 50,000, what should the rate sort of be after you kind of hit those pieces? So maybe in the discussion, one, how do you feel about sort of that sort of, cap of it? And then 2, what are your thoughts on sort of the sort of margin at the margins, what it should decrease above that level of payment?
So I'm going to add one of the things that I think we need to look at. The chart you had was what's the dollar contribution by income level. I think we also want to have what's the percent contribution by income level. So we can look at both of those. In the dollar contribution clearly looks like, oh, that's really progressive. But if you actually look at the percentage contribution, it's actually not progressive. But I think both of them are necessary to make the discussion a little bit fuller so we can understand what's going on there.
Yeah, Charlie's right.
There's another way you could do the cap as well, which I did not implement, but Richard had suggested it, and that's not start the cap at a contribution level, or not start a lower marginal rate at some particular contribution level, but add some particular income level. And that would take a bit of work to try to implement that. But I think it wouldn't change the general discussion very much, though. So I don't think it's necessary for the discussion. And I guess I'll stop there.
Actually, since you had your hand up, do you want to stake out a position on the sort of should we have it, and then the thresholds?
Boy, I am. I kind of think we should, but I kind of think we shouldn't. So I'm conflicted on this one.
Right.
But I think we should think about it. Absolutely. So I would say 100% we should be thinking about it, and we should present scenarios to the governance board, both without a cap and with some sort of a soft cap.
So there's a couple different concepts here. Once you've paid in, let's say, $50,000 of healthcare personal income tax, should your rate go from whatever it is, 10% down to 5%, or should it go to 0%, meaning you don't pay any more? And what I'm thinking about is that if you get someone that's a high income and they say, how much you paying in Oregon for healthcare personal income tax? And they say 100,000. Well, even if they have a family of 4, their annual health expenditures are probably not more. I'm just rounding it off to say 25,000. So you're paying 4 times as much as your family consumes in healthcare on average across all players in the state. There's a certain thing that doesn't make sense. It's different from an income tax that has nothing to do with healthcare. The more you earn, the greater percentage you pay. Got that. But when you're saying it's a healthcare personal income tax, to start saying you're paying $100,000, I'm just making up the number, but somewhere you're going to get into that. Sometimes it fails the smell test or the logic test. So I'm conflicted too. One is, should we just have a decreased rate after the cap, or should we have no more income tax at all after the cap? Healthcare personal income tax, I'm not sure. Thank you.
John.
Yeah, I mean, I think this is a marker and an important marker for a discussion that we need to have more data on. How many taxpayers are we talking about at $500,000 and above? How many of those taxpayers are at the 1% highest income level, versus the 1 to 5% income? Again, the more and more I read about inequality of wealth, I mean, we really have super rich folks. Now, my understanding from Oregon is that we don't have that many super rich folks here. You get into other aspects. Some of you may have heard about some of the controversies that going on about the agricultural tax credits or breaks for people who claim that, you know, they are in agriculture. And so many wealthy people have a stand of timber, or they have alpacas, or they have basically hobby farms. They hate that word because they don't want that tax credit or whatever challenged. And so, you know, I mean, I'm happy to see that there is a burden falling there, because I personally feel that's the most defensible a place for a burden to fall. And I think many high income folks would agree with that and participate. Are there some things that, you know, could be done that could moderate that or make it more fair? Maybe, but again, you almost need to talk to the accountants that serve that population and all. You know, would their reaction to this be, well, we're going to go after other tax shelters to protect us from this tax? You know, I don't know. I mean, I am for elements that would modify it or moderate it, because I think it indicates to them that we're thinking about them. I'm not sure whether this is the best way to go, but for purposes of this discussion, I'm fine with this as a marker to hopefully have more of a discussion, and in some way or other reach out to them. So that's my 2 cents.
Thanks, John. Mary Lou.
I guess I'm with John on this. I'd like to kind of know how many people are we really potentially talking about? And, you know, another, you just called them the super rich. Tom Hartman the other day called them the morbidly rich. I kind of like that term, especially when we're talking healthcare. But I'm looking here at a street roots of a couple weeks ago. I was looking at Multnomah County, numbers of high income households in Multnomah County, 2014 to 2023. And it looks like it's about 5,000 people. And I would assume that Washington County has a goodly amount too. But anyway, I would be interested in knowing, you know, how many of these we're talking about. And I do think that, you know, it does make just the sniff test or the, you know, kind of fairness thing, although progressivity and fairness aren't always the same, that, you know, at some point, I think that I would say to lower that amount or even say you've paid enough. But what would that do to the calculation? I'm not sure.
Charlie.
So we do have data on the number of people affected to some extent. So, and it's in the spreadsheet, you know, in the more detailed part of it. So the state of Oregon provides data for various AGI levels, and the highest level they have is above 500,000. So there are 30,000 tax forms filed with an AGI greater than 500,000. And the average income, or the average AGI for those folks, is 1.2 million. So that amounts to 36 billion among those 30,000 filers. And with the kind of tax rates we're talking about, the average, if you do not do a soft cap, the average amount that they would pay in healthcare personal income taxes would be 120,000. Yeah. And that would, you know, for 30,000 families, that'd be 3.6 billion of the revenue that we're trying to get. I am completely against a hard cap that you say above this amount you pay nothing. But I am actually I do like the notion of a soft cap. And how soft? I mean, like what's the marginal rate above some threshold? I don't know. But if you look at just those 30,000 people, assume that they would otherwise pay, let's say 40,000 for their family and healthcare. They're going to be paying perhaps an extra 80,000 per year. So that's an extra $2.4 billion. And so they can say, okay, let's do 1 month of the excess we're going to pay to fight against that. That's $200 million they have to fight against our bill. So, I mean, I think, and somebody said this, and I agree with it, that we at least want to show those high income people that we're thinking about them. Yeah, we're going to ask them to pay a whole lot more, but not as much more if we just did a flat progressive tax. So anyway, I'll stop there.
Thank you, Charlie. John.
Yeah, I might mention another idea. I don't know whether it would be a double tax that would help people probably with incomes, people over 65 or 70 with incomes over 100,000. And that's, at 70 or so, I think that's the age, we're required to pay we're required to have a required minimal distribution on retirement plans. So about 5% of your retirement plan has to be moved from the pre-tax to the post-tax side. One of the tax advantaged way to contribute for people of that age and who are in that situation is you're actually allowed to donate to a charity directly and not pay taxes. And that's certainly something the charities all know. Imagine if the same thing were true here, that in terms of required minimal distributions, the degree that you paid, you would not have to pay state tax twice. You follow me? Once, when it comes and then again, I don't know if that's double taxed or not. Probably not. Thinking through it, but if you didn't have to pay state tax on that as it came forward, it would, I think, lower things or moderate things a little bit. I'm not doing a good job of that, but there's other things I think that we might think about.
Okay. Jeff and Bethany, you want to weigh in on this?
I don't have anything to add beyond what's been said.
Wait. So what, oh, go ahead, Charlie.
So my understanding is that in the scenario that you presented, you did have a soft cap that was like half the rate starting at 50,000. I don't remember something like that. Is that correct?
Or I think I might have had 50,000. I knocked it down a point.
So in the scenario you presented with the numbers that you put forward initially, you actually did have a soft cap that was like half the marginal rate below that. Is that right?
I think it was a point. I think I had well, maybe it was a point and a half. I hope I'll go back and double check, but
okay. But you actually did have a soft cap in that scenario. Yeah. Okay.
Yeah. So what I'm hearing here is we want to preserve optionality here, and that folks that generally are feel good, like, well, we should probably think about one where there's none, and then present it one with there is something that phases in, and we can keep that conversation alive and that choice alive. So that seemed fair to everybody. Great. Mimi, just time check. Do we need to reserve some time for public comment at the end of this one? I can't remember.
Yeah, actually, Isabel, do we have anyone signed up for oral comment?
We have 2 people signed up. Neither of them are present at the moment. Or they haven't shown up throughout the meeting, so I'm not sure right now.
Okay. Well, go ahead, Charlie.
So now if we do have time, there is something I would like to bring up related to federal Medicaid cuts and things how we can think about that. So,
Well, I think we can move through this one here, but it is just the
okay.
discussion. So on the premium side, it's our last piece, but I think we'll probably some time.
Okay.
And Charlie's done some digging in there as well. So so thus far, right, we basically, employer payroll tax credit against income taxes that then changes the progressivity of the existing income tax to be the primary funding source of the universal health plan. The other big component that individuals would pay outside of just the personal income tax is this sort of personal premium. And I think we had some discussion here. Probably the most efficient way would be to sort of structure it as part of the income tax, just administratively, in order to sort of calculate and administer and collect the tax. And so here there are choices, right? One, in much like you can design the income tax, you can also design how the premium works to deal with these issues of how much money are we going to raise, how progressive should you structure it, and the two pieces would be the total amount, right? So what are people paying, and when does it phase in with respect to the federal poverty level? So I guess the questions here are really about, I guess, if I had to remember the conversation, should we have it? And I think from a revenue perspective, the income tax would have to, and other taxes just have to be so much more higher, have to be higher in order to compensate for that. And then two, if we do have it, how progressive should we structure this in terms of that? So want to get people's thoughts on those key questions.
Well, I guess I would say to stay consistent, the progressive idea I like. And somehow I think that 200 is a little low to start. I would make it more 250 or so, I think. But anyway, that's
Yeah, and just I had that thing. The phase-in piece here is pretty significant, going from 2 to 250. There's a lot of payers in that bucket, so it has a pretty large revenue impact.
I know.
Um,
Anyway,
right, Charlie. Oh, okay. We'll go to Richard real quick.
So in this area of lower and middle income people with insurance, I think we're ignoring a lot of that, trying to keep their healthcare costs and their healthcare tax at zero. And I don't think that's appropriate. For example, one of my daughters is on a marketplace plan, and she's not high income, and she'll get some credit, at least through the rent of 25 before the HR1 kicks in. But already her premium without the credit is $475 a month. So that's nearly $6,000 a year. Then once the HR1 things cut in, her premiums may go to $8,000 or $9,000 a year without much of a credit. And to get that insurance, she has to accept an out-of-pocket maximum of, get this, $7,000 a year. I mean, so if she has a bad year, she's out up to $13,000. So this idea that people at low incomes of 30, 40, 50, 60 shouldn't pay anything in terms of an income tax or healthcare premium tax, I don't think that's appropriate. I mean, we want to make it just, we want to make it progressive, but they're really getting hit out there, and we need to say, when we go out to the community, to say, here's what you're paying out, not in healthcare income tax or personal premium tax, but here's what you're paying in terms of your premiums and your out of pocket, and make the case there. But we shouldn't have zero tax in those low and middle incomes, because they are paying high healthcare costs, just not in taxes. Over.
Okay. Thanks, Charlie.
I mean, I somewhat disagree. I think for low income, we shouldn't have any taxes, but how low? And so I actually think that 200% of federal poverty level makes some sense. And I would also say that, again, we can say, well, there's a couple ways to approach this. One is, how much do we want to raise from the premium? And if we lower the, or if we increase the federal poverty level that's exempt, we could increase the amount of the premium. So there's again, two things can be adjusted to keep the total revenue about the same. But again, it's not clear to me if there's a good target for how much we should raise by the premium. It's just, I think one way to figure out the target is see what everything else does. Have a target for the income tax rate that we want to have, and then adjust the premium amount to get there. I actually kind of think that 200% is maybe the right place for this cutoff. So, and it may be even a little bit lower, but because of the basic health plan in Oregon, I actually think that 200% makes sense.
I'm looking at this table. So it looks like 200% of federal poverty level, federal poverty level for two people is about 40 to 45,000 in adjusted gross income. So just for a reference point.
Yeah.
Mimi.
Yeah, can I ask you a question? Do you have, I'm just trying to follow this conversation on the table. Are you talking at all about having the amount of the premium graduated at all? Or is it a little bit binary that either you do pay it or you don't?
I'm assuming we probably could structure it in a number of different ways, but the way the model has it right now is as a flat amount with a phase in.
Thanks.
All right. Mary Lou.
I guess after listening to everybody talk, etc., I'm okay with 200.
John. John, are you there?
Sorry, had trouble getting that to come on. I'm for 200. And here's where, again, a concept I've mentioned. I think people between 200 and 600% of the federal poverty level should realize that they're basically contributing to a trust fund that will be there for the rest of their lives and will provide them a much better Medicare benefit than they had ever been able to plan for. So to me, I think there is a justification for people at lower and middle incomes to have a sense that they're contributing to their future in terms of healthcare. And so I just wanted to put that piece in.
Great. Thanks, John. Charlie.
I mean, so it is just a phase in, and but it basically that it makes it so it does change depending upon your income level. I mean, you pay zero from in per person from 0 to 200% of federal poverty level. Then you pay an increasing amount from 200 to 400% of poverty level, and at 400% of poverty level, you pay 5,000 per person. So really, it is already adjusting for income. I mean, that's what the phase-in does. And that's intentional. And the other thing to keep in mind is this adds to the progressivity of the effective personal income tax. So it makes the tax more progressive than it would otherwise be.
And just clarity, when Charlie says the effective one is the combination of the personal income tax plus the premium. Yeah. Jeff or Bethany, any other pieces here? But what it feels like here is the exact amount in the phase in is really going to be downstream of the rate setting piece here, and that I'm just probably queuing up our next conversation, but it's basically now that we've kind of nailed down a few of these ideas, the next kind of scenario would really be kind of looking at different sort of marginal rate structures and optionality, and then what the implications would be for things like the premium, how, you know, basically how much needs to be raised there and how progressive do you want to make it look. So, but with that, any want to just make sure, Jeff, Bethany, any other thoughts on this?
200, 225. I mean, it's with all the moving variables, it's premature before having a specific number.
Okay. Great. Great discussion today, everybody. Thank you very much. I know we're kind of running up here on time, and Charlie wants a little bit of space if we have it. Mimi, can we give Charlie a few moments on the Medicare cuts question?
Yeah, absolutely. As long as do you want more time? Do you need time to sum up, Morgan, or are you good?
No, I think just quickly, I think the next steps here, briefly, is we have enough here to kind of start putting together some ideas, some scenarios here, and with a little more clarity to say, hey, we think this is where you're going. What you said, here's how you would structure the taxes. Here would be the rates. This is how the progressivity would look. So I think we can tee up another great conversation.
Great.
In September, I think really focused on kind of rates and thresholds. So this is fantastic progress.
Jeff, did you have something you want to say before Charlie?
No, I'll wait. A topic to bring up, but I'll wait for Charlie.
It looks like Mary Lou, you had something.
Just real quick, is this discussion going to be presented at the board on Thursday, or you know, as it is?
Yeah. So basically, we're going to start basically the last 3 months. I have to kind of cover kind of how we did the sort of level cost, you know, the funding gap, and then try to then bring them forward to this conversation.
Okay.
Okay, Charlie, hit it.
Okay, so one of the things that we're all aware of is that the HR1, the federal bill, has cut Medicaid spending. So the amount that under current federal law, if you do not have a waiver, the amount that you get for Medicaid is just a matching amount, and it depends upon how much the state pays Medicaid providers or providers who serve the Medicaid population. And so if a state were to increase the amount that they paid Medicaid providers, they would get more federal matching money. And so one of the suggestions on how states could deal with the loss of Medicaid money is to pay more money to Medicaid providers, then you get more federal money. Well, how are you going to be able to do that? One of the ways you could do that is, even now, before we have a universal system, is to increase the payroll tax so that you pay more for Medicaid patients. We're going to be paying, you know, if we have a single payer system, we're going to be paying a whole lot more for Medicaid patients. And therefore, we will get more matching federal money if we do not have a waiver. And so it makes the question about how do you design an appropriate waiver more complicated, because maybe we don't want to get a Medicaid waiver so that we can get a lot more federal money. And so I would just say that, and my rough calculations would say, if we use Optimus numbers for how much more a normalized system would pay for Medicaid providers, we would more than make up for all of the loss of Medicaid money that is that would be attributed to the HR1, the big beautiful bill. But the 1115 waivers require no increase in federal deficit. So it seems like there's a discussion here of how do we preserve that. And then the other piece is, when we're trying to get this implemented, we are going to need waivers for other pieces, and it won't be with this current administration. And we might have to estimate what's going to happen for federal dollars that is going to be very different than what it currently looks like it is. So I would say we have a big uncertainty that we may end up with as much Medicaid money as we had previously thought we were going to get from the federal government. We may lose quite a bit. And so I would just say it is not clear that we're necessarily going to have to budget for losing money from Medicaid. We may be able to say, it's possible we could get the same amount or more, even a little bit more. So, and this relates to something that Optimus had put into their design where I had previously questioned their $2 billion extra. And now I'm saying, maybe we could get it, and maybe we could get even more than that. So, anyway, another complicating thing. So, thank you.
Thank you, Charlie. Jeff.
Sorry,
It looks like
I was frantically trying to get my screen back. Thank you. Charlie, I gotta love your optimism. So good on that. Since we have the governance board meeting coming up this Thursday, I think it might be beneficial for us to ask them for some guidance on the direction that we're going. It seems to me that we have in front of us right now, with all the good work that has been done and the good conversations and the narrowing, there are three options that we would like to get the governance board to say, yes, keep going down this road. Option number one is the road we're going down, which is basically single payer, universal health care, 18, 20, whatever the number is, $1 billion, however it is structured, in additional taxes. That's option one. Option two is to say, if our goal is just the universal health care coverage, there's about 3 to 5% of the Oregonians who do not have some kind of health care coverage. I'm willing to bet that the cost to cover that 3 to 5% with some kind of health coverage is less than what we're projected for the incremental right now. And I think that's an option. I want to know, does the governance board want us to go look at that because of option one with the expense that we were looking at that? And then option three strikes me is that we're going down the assumption of, as I've said, PEB plus, or as we've talked about, PEB plus. We have the approximate design for that, the approximate cost for that, additional taxes for that. Do they want to say, hey, we don't think we can do this. Take a look at a different option than PEB plus for the coverage and what it's going to take to finance that. I think it'd be beneficial for us to hear from the governance board saying, of those three choices, we want you to keep going the way you're going, look to cover the 3 to 5%, or look at a different coverage other than PEB plus. So.
Thank you. Yes, I think that all of those questions and more are going to be brought up to the board. And I know that they have been having a lot of discussions around this. So I think that there certainly will be some direction coming back your way, and sort of the more specific that this group is able to build their questions. I think that it will be the more the board will be able to respond. And of course, to Jeff, there will also be, there's a lot more information coming into with some of the estimates coming from Milliman. So there might be a little bit of a time lag as well.
And just to that, we're all working with estimates right now, and I'm looking for direction. I think we need direction from the governance board, what I call it vaguely right versus specifically wrong. And the three options I just presented, I think, are three vaguely right options. And we should get some direction from them saying, as I said, keep going the road we're going. Don't go the road we're going. Try and find a way of covering the 3 to 5%, or don't go with PEB plus and come back with a revenue option, revenue finance plan that doesn't do that.
Right. Thank you. Yeah. As I said, they definitely are. They're considering a lot of options. Those certainly are some of them.
Hopefully they'll tell us.
I think you can lean on Mary Lou. She's going to be there.
Yeah.
All right. Thank you all very much for this incredible meeting and for taking the extra time to have an additional meeting during this month. I know a tremendous amount of work has gone into it from our committee members and for our consultant group, Echo Northwest. As I mentioned, if you have the opportunity, please do join in the board meeting, which is this upcoming Thursday. If you really want to have a good time, you can come in person. It's in Salem, or you're certainly welcome to Zoom on in. This group will meet again in 2 weeks. That's correct. Should probably look at my calendar.
September 2nd, I believe.
September 2nd it is at 9 a.m. this time. So, all right. So thank you all very much. And we'll conclude the meeting and we'll see you all shortly.
Have a great
Thank
Labor
you.
Day.
Bye-bye.